If your girl parts itch and you want to know what the best thing to do to treat it fast is, I'm going to tell you that what I recommend is not necessarily what the literature recommends, because I differ in this one. Hi, I'm your local OBGYN. I love women, and let's talk about it. So studies, they matter. They do. And there's a lot of value in them, and sort of learning and practicing by these guidelines. And we say evidence-based medicine. There is some value to experience, and I've been around here for more than a minute, and I have a lot of experience in vulvovaginitis, when your insides are itching and discharging cottage cheese and the outside is irritated. And a lot of you just need relief quickly, and you are trying to get in with your gynecologist, or maybe you don't have one, so you go to your local pharmacy. That is not the worst thing you could do, because there are antifungal vaginal preparations that really can help. But which one do you get? We all know that when you look at the antifungal or the yeast creams that exist, there's a 1 day, there's a 3 day, and there's a 7 day. And I'm going to tell you, this is the important thing, because this is where I differ. When you look at the literature, it says that the cure rate of yeast is relatively equivalent in all of these formulas. However, in the 1 and the 3 day, there can be some excess mild irritation compared to the 7 day. This is crap. My personal take, having seen women who use this stuff every day, every week, and a lot of them end up back in my office, is that the 1 and the 3 day do not have mild side effects for some people. There is something that is stronger, that is more irritating. I have seen vulvas completely swelled closed as a result of the 1 and the 3 day formulation. And I also see more recurrent infections that aren't completely cured from those formularies. So go with the 7 day formulary of an antifungal, because it is less irritating to your insides down there, and you'll have fewer side effects.